Welcome. My name is Jana Hopstaken. Also on behalf of my co-authors, I would like to present to you an updated systematic review on focal therapy in localized prostate cancer. What has changed over the past 5 years? Prostate cancer is the second most common type of cancer in males. Current treatment strategies for localized prostate cancer are active surveillance, which consists of half-yearly or yearly tests and doctor visits, or whole gland treatment options such as surgery and radiotherapy. Both surgery and radiotherapy are associated with morbidity, such as urinary incontinence, erectile dysfunction, or bowel dysfunction. These adverse outcomes may all impact the quality of life experienced by patients. Now, an innovative treatment that seeks to minimize these adverse events while maintaining a good oncological outcome is focal therapy. In focal therapy, the so-called index lesion is treated, which is the part of the prostate that harbors cancer and determines the patient's prognosis. So what do we already know about focal therapy? In 2017, a systematic review by Valerio was published, in which they assessed the ideal stage and the evidence available on functional and oncological outcomes. They did this using literature up to 2015. They identified 37 studies investigating 7 modalities in focal therapy. And these studies were mainly single-arm developmental studies in ideal stage 2A. And they concluded focal therapy is a promising new technique, especially concerning functional outcomes, but that the oncological effectiveness still needed to be defined. So our research question was, what has changed over these past 5 years? We wanted to assess the effectiveness of focal therapy for functional and oncological outcomes in patients with localized prostate cancer and to evaluate the ideal stage progression of the studies over these past 5 years. So we did a systematic review and searched for studies published between 2015 and December 2020, and the requirements were that the studies had to have as a target population patients who were treatment naive for localized prostate cancer, meaning they didn't have any other treatment prior to entering into the study. The intervention should consist of any form of focal therapy available. We did not require a control arm to be in the study, and our outcomes of interest were the oncological and functional outcomes. And we also did a search for currently registered trials at clinicaltrials.gov. So we screened 5,005 studies on title abstract, followed by a full text screening of 218 studies, eventually leading to the inclusion of 70 studies for our final analysis. And these studies included over 6,000 patients and investigated 8 different modalities. And as you can see in this pie chart, what immediately becomes clear is that HIFU, high intensity focused ultrasound, was studied most often with 26 studies. And that, for instance, radiofrequent ablation and prostatic artery embolization were studied in 2 and 1 study. Of course, we looked at the ideal stages of each study, and here we can see that the majority of studies are still in stage 2A and stage 2B. However, we did identify 4 studies in ideal stage 3, namely the first ever randomized controlled trial on a form of focal therapy, namely photodynamic therapy or PDT, 1 feasibility RCT on HIFU, and 2 propensity score matched analyses on IRE and HIFU. We also identified 1 stage 4 study, which was a retrospective study including 1,032 men treated with HIFU. This study had a median time of follow-up of 36 months. We also looked at the currently registered trials, in which we identified 43 studies on focal therapy, and based on the descriptions here, most modalities will still remain in stage 2, although there is expected stage 3 and stage 4 study results for HIFU and PDT. And we also identified a new modality in focal therapy, namely microwave ablation. But of course, we were also interested to see the ideal stage progression per modality, which is depicted right here. So let me take you through it. On the y-axis, we have the number of studies, and on the x-axis, we have all the modalities. Each modality is subdivided in a time period, of which the time period beyond 2020 are the studies identified at clinicaltrials.gov. Each bar is also expressed in the ideal stages. So to give you an example, we can see that for IRE, in the period of 2018 and 2020, 6 studies have been published, of which 1 was ideal stage 3. So now it becomes clear that over the past 5 years, ideal stage 3 and 4 evidence has been generated for HIFU, IRE, and photodynamic therapy, or PDT. At the same time, we can see that FLA, or focal laser ablation, cryotherapy, and focal brachytherapy have all been studied in ideal stages 1 up to 2B. Moreover, we can see that despite evidence of 2B studies has been delivered for focal laser ablation and brachytherapy, in the future, ideal stage 1 studies will be performed for focal laser ablation and brachytherapy. In the last column, microwave ablation is depicted, and here we can see that in our systematic review of the past 5 years we identified 0 studies, whereas for future trials we identified 5 studies. So to come back to our research question, what has changed over the past 5 years? We can see that more studies on focal therapy were published than 5 years ago. They also investigated slightly more modalities, and they more often used a comparator arm. And the first ideal stage 3 evidence in focal therapy has been delivered, with the first ever randomized controlled trial in focal therapy for photodynamic therapy, or PDT. However, the majority of studies still remain in ideal stage 2A and 2B. And we also see future studies investigate new modalities, which all inevitably have to start in an early stage. And finally, we also encountered a considerable heterogeneity of studies, for instance, in which type of patient to treat, the biopsy method used, follow-up, and also definitions of outcomes such as clinically significant cancer. So what are my take-home messages? Focal therapy has been studied extensively over the past 5 years with 70 studies. And though we see a progress towards advanced research stages, the majority of studies still remain in stage 2. And this is quite unfortunate because if we want to be able to provide our patients with focal therapy as an established treatment, we are required to generate robust evidence in form of an ideal stage 3 study. Thank you for your attention.